All right. Thank you so much. My name is Jamie Trotter. I'm the Associate Director for Patient Advocacy and Engagement at Patient Advocate Foundation, and I'm so excited to be joined in conversation today by Ms. Lillie Tyson Head, who is the founding president for Voices for Our Fathers Legacy Foundation, whose mission is to preserve the history and the legacies of the 625 men victimized and unethically treated in the United States Public Health Service study of untreated syphilis in the Negro male at Tuskegee and Macon County, Alabama, from 1932 to 1972. I was struck, I'm sure as many of you were, by Dr. Stanford's talk. I also had the privilege of starting to read some of her book that she discussed during her speech. And one quote that I highlighted and pulled from the book, it's a quote actually that she references by G.K. Chesterton, that says, "The true soldier fights not because he hates what is in front of him, but because he loves what is behind him." And I think that stuck with me in preparing for this conversation with Ms. Head, because I think it really captivates the essence of the work of Voices for Our Fathers and the work that Ms. Tyson Head does. So I'm so excited. She has quickly become one of my favorite people in the brief time that we've known her. And so I would like to jump into this conversation and obviously give her an opportunity to introduce herself. But I'll start off with this question. Much of the work that I do and our team does at Patient Advocate Foundation is centered in amplifying patient voices and narratives through storytelling. But as Gwen mentioned in her introduction, as it relates to building trust, as it relates to maintaining truth, and as it relates to healing, much of what matters the most is the words that we use in our language. And so, Ms. Lillie, I'm wondering if you can speak a little bit about the choice of words when referring to this study and how and why language matters so much as it relates to health justice.
Well, good afternoon, everyone. And Jamie, thank you so very much for inviting Voices for Our Fathers to be a part of this very important conversation. Our work that we are doing mirrors a lot of your work by working together, joining with other partners to bring about health equity. This study has always been referred to as the Tuskegee syphilis study. And if you think about that for a moment, you understand that when you say Tuskegee syphilis study, you are placing the responsibility and the ownership, the accountability for that study on Tuskegee. You're placing the blame and the shame on Tuskegee by just using Tuskegee in front of the study. That's the first part. The second part is the fact that when you do not tell what the study is supposed to do, you're also inviting a lot of conspiracy theories, as well as putting out disinformation about the intent of the study. And then when you leave out the people that have been mostly affected by the study in the small community of rural Macon County, you disregard that whole community. And that shows disrespect. Voices for Our Fathers have been working diligently since 2014, when the foundation was organized by descendants as a nonprofit at Tuskegee University. And of course, you know, that's where the study took place, at Tuskegee. We have been working hard to change that concept, because it was time that people knew that it was not Tuskegee's study. It was not the Tuskegee syphilis study. It was the United States Public Health Service study of untreated syphilis in the Negro male at Tuskegee and Macon County. It's important that you know that what the study was about from the beginning. The intent was to wait for the men to die so that they could prove one of their eugenics theory. And for those who are familiar with eugenics, is to say that there's one group of people that's inferior to the other group of people, and it affects certain parts of that particular race's body, which would have been the intellectual body of the African American men. So, in our work and working together, and I'm so happy to see your theme for today, with achieving health justice together, because that's what we're doing. We're working together. So we started with correcting the name, and we have recruited people from the CDC Centers for Disease Control and Prevention to correct that name. And the other reason is we have also included now and partnered with the National Institute of Health and the California Association of African Americans Administrators and Superintendents, among others. So we are partnering, and that's what we have to do, is together, we have to work together to change the inequities in health. So I'm asking all of you who are listening today, and forgive my voice, it's a little weak. My voice is a little stronger than this, but I hope you can hear me clearly. We're asking everyone to refer to the study, what it was, so we can get away from misinformation about the study, disinformation about the study, and get rid of some of the conspiracy theories that are out there.
Thank you so much. I loved what you had to say about really, it's more so about, I think, accountability and as you spoke about dismantling mistruths around what actually happened in history. And I know that that's actually a theme that's been really becoming more prevalent, particularly in the political landscape. There seems to have been an attack on DEI efforts, more specifically, attempts to erase, or I would say suppress, some of the historical harms that have happened in this country as it relates to racism. Can you talk about the founding of Voices for Our Fathers and why it was so important to not only preserve the history and the truth, but carry forward the legacy of the men in the study and the work that you're continuing to do? I believe you mentioned 2014 was the founding. So if you could talk a little bit about the inception and how that came to be.
Sure. And let me back up just a little bit. And then at the end, I want to share a little bit about history and how it is being attacked in some places. In 2014, families had gathered together at Tuskegee to commemorate the 1997 presidential apology by then President William Clinton for the study at Tuskegee and Macon County. And in that commemoration, that the National Center for Bioethics and Research in Healthcare, that was an outcome of that apology at Tuskegee. The center had started to commemorate that apology each year. So from 1999 until 2014, the descendants had only been meeting and taking part in the commemoration, but felt that their each year we felt there was much more that we could do rather than to just go and to hear others talk about the study from a scientific and an academic framework. We didn't see the humanity of our fathers. We didn't see how it had impacted the lives of their children, their wives, of the community. There was no mentioning of those types of impacts and indifferences within the descendants of those men. And most of all, we saw where those men were not the men that they were talking about only as guinea pigs and poor and uneducated and didn't care about their health and wasn't conscious of living a respectful life. They were promiscuous in their actions. Those were not our fathers that the study, the legacy of that study had left. They were not, our fathers were not those men. Our fathers were loving, they were kind, they were leaders, they were pillars in their community, they were disciplinarian, they were good citizens, they wanted to join the armed services during World War II, but were denied because they were in the study. That had to be changed. And it was our responsibility to change them for the better. If we left them in that stage, we would be doing, in my mind, almost as much injustice as what had been done to them. And then after we found that out, or came to that conclusion, we knew we had to do more. We knew we had to honor them. We knew we had to remember their legacies. We knew we had to tell their untold stories. And we knew that we had to use their platform to make changes in the healthcare system. And that's what we're all about. And that's what we're trying. We're trying so desperately to do during these days. Our purpose is to transform that legacy of shame and trauma to honor and triumph. And as of today, I think we are on the move forward together, changing that legacy. And that's why I'm so appreciative of being here today, to be a part of working together to change, because we can, as long as we're doing it together.
I thank you so much for the work and the transformation that you're leading. And I really felt when you said those were not our fathers, those were not our men, because I think so often in science and in experiments and in medicine, patients are seen as subjects, patients are seen as patients. But one of the things that we talk about and really focus on when we're talking about equitable care is just treating the whole person and person-centered care and understanding what matters most to them and seeing them beyond how they present, for the 40 minutes that they're in front of a doctor. So I thank you for the work that Voices for Our Father is doing and for being here with us today and sharing this story. I was introduced to you a couple of years ago when you were doing a webinar with the ABIM Foundation. You were in conversation with the Millbank Memorial Fund, who had issued a public apology, I believe in 2020, because of their involvement in funding the burials of the men of the study, but only with the caveat that the families had to agree to provide an autopsy in order to receive the funding for the burials. So I want to ask you, in your opinion, how can public health initiatives be redesigned to better support health justice and to be more inclusive and equitable when involving patients and their families in health services research?
Well, the first and foremost in my mind, especially with the research, because it particularly parallel with the men and the study that was done at Tuskegee and Macon County. The first thing is truth. Be truthful. And by being truthful, I mean telling the intent of the study, what is being looked for in the study, what will the study show that will help to understand the cause and effects or whatever it is the research is about. That's the first thing. The men were lied to from the very beginning. First of all, they were never told they were in the study. And second, they were never told that they had syphilis rather than bad blood. So the diagnosis was wrong in the first place. And then they were promised that they would be treated for that bad blood, and they were denied. They were not. And then the most grievous part of that, the most horrendous and humane part of that, was when penicillin was discovered, they were denied treatment. And that is the first thing that has to change. It has to be open, truthful, and trust, and open, truthful, and no deceptions. It has to be. And that can only come when those who are doing the research or the care are respectful of another human being and their dignity and the rights of that human being being treated as they would like to be treated themselves. That's the first and foremost thing, because before trust can come, you must have trustworthiness. And you can only get trustworthiness if you're truthful and you're open, you're honest, and you're caring and compassionate, and you show that. The second thing would be the accountability of the doctors or nurses or whomever is providing the care. They must show accountability for their work. If something is wrong, then the truth should be known about it, and there should be some accountability for that. And then third is the accessibility for healthcare. And that's very difficult to do because the affordability of healthcare. We know that we do have the Affordable Care Act, which was a big help in providing healthcare for a lot of people. But there's still so many people who do not have healthcare. And then the last, which is also important to me, is the availability. The care can be out there, and the opportunities for research can be out there. But if it's not available and the people are not informed, then you still won't have that participation and the people won't get the information that they need. So it has to be also available.
Amazing. I want to take a second to remind the audience that this conversation does have a live Q&A. So if you have a question, please do drop it in the Q&A function, not in the chat, but the Q&A function, and we will have an opportunity to discuss those in just a few moments. Knowing that states like Alabama, we do a lot of, as I think Gwen alluded to earlier, one of our partnerships is with a very rural community in Ruleville, Mississippi. And we know in Mississippi and Alabama, among other southern states, that Medicaid has not been expanded in those states, and it disproportionately impacts communities of color and underserved and underinsured populations. Also understanding that we have a new administration coming in, and they have made in the past attempts to repeal the Affordable Care Act, and have spoken in this election around concepts of plans to replace healthcare as it stands today. What policies or reforms do you believe are most critical for advancing health justice?
Jamie, I'm going to reflect for a moment only on those rural communities.
Mm-hmm.
And the reason for that is because those are the ones that are most underserved and the most in need. And within those communities, and I'm hoping and praying that the new administration will not interfere with the ongoing progress of the Affordable Care Act and health care in those most needed communities. But when you talk about health care, I look at, and I think you mentioned the whole health of a person, not just the physical. So when you look at the whole person as a whole, there are a lot of other things that impact the healthcare. So I'm hoping that, first of all, the expansion of Medicaid within those communities are increased so that people can get proper care, especially with the seniors. I see so many seniors now who are suffering because they cannot receive certain benefits of Medicaid. And that's quite disturbing. The second thing would be in the quality of education and the affordability of housing within those communities. Increasing the diversity in the care of the people who are responsible for providing that care. And doing something that I see that is coming aboard right now is educating those future caregivers and researchers on addressing and working with people of all cultures, all social statuses and educational statuses. And I say that because for the past 4 years, Voices have been working, collaborating with Thomas Jefferson School of Medicine, Sidney Kimball School of Medicine, talking with their first year medical students about caring, compassion, honesty, and trustworthiness. And it seems to be taking an effect on their attitudes towards what they're looking for from their new careers and treating people with dignity. So those are just a few things that I think are important. But one of the most important, what I'm seeing, because I'm a senior and I'm seeing a lot of seniors suffer, is the expansion of Medicaid to seniors.
Absolutely. Well, we are champions for that, and we will continue to partner with organizations like Voices and the work that we do in communities that hopefully will move the needle towards, some of that effort. I know we're coming up on time, so I do want to get to one last question that I have for you and then turn it over to pull in some of the audience for their questions. I know that we're at a pretty divisive point in this country, and understanding the current climate, what would be your call to action for on the local level for people just like you, for like me, advocates who want to enact change and who are fired up and still want to move this work and bring awareness and progress towards advancing health justice? If you could give us one call to action, what would it be?
It would be, and I thought about this for a while, and it would be to become an active part in something beyond ourselves. We have to look beyond the me, and that something is humanity. We have to look at humanity and how we regard, address, assist each other, and the expectations that we have for treating each human being with dignity and with respect. So we have to get involved with something beyond ourselves. And we can do this on a daily basis. Number one, we can become more educated about what is happening in the health field. And we can also advocate for those around us who do not know, and we can speak out when we see something is wrong and not stay silent by. Our voices are powerful and we can make a difference.
I want to say amen, but that probably wouldn't be that appropriate. Okay, I'm gonna bring in some of the audience because I think we only have a couple of minutes, but there's quite a few questions. We did have a question from, I'm not sure if it's from Kaiser Permanente or about, but how, I know we answered this, but I think we should re-emphasize this, how people should refer to the study, and what is your website should they want to learn more information?
Okay. If someone could type it in, or do you want me to type it in?
We'll have Ashley type it into the chat, but you can just
Okay, it's info at voicesforfathers.org.
Amazing. All right. One more question. What strategies or stories do you think will be helpful in dealing with politicians, policymakers, and community members who are anti-DEI and against so-called woke related activities in healthcare and medical education? How would you speak with individuals to create a safe, brave, inclusive, and mutually respectful learning environment? That's a great question.
First, I think we have to look at where their frame of mind is at that particular time. You know, why is it that you don't want to talk about diversity? What's the reason for that? And then once we get that out in the open and perhaps understood, we can move forward. There's nothing to be afraid of and to be ashamed of past wrongdoings in our history. For us, we were not there. What we have to be ashamed of is if we're not doing anything not to repeat the past. So it's a good thing when you can apologize for a system, not you, but for a system that has been wrong, has wronged a lot of people. But you can come together and say, no, it will not happen again. And I think that's the beauty and the power of what Milbank and Voices are working together to do. And that's to show that you can work together. You can heal, you can acknowledge the harm, and you can show how you can come together to work so that it doesn't happen again. And it can make a difference for people who are living every day. I think the most important thing is being able to acknowledge. And if I could just have one little minute, I have been working with high school students and middle school 8th graders this year and years in the past. There's a national history program that is out there where the students can get involved in. And these students have wanted to learn more about the study and talk about the injustices of that study and do some critical thinking on it and see why it happened, how it can happen again, and how to prevent it from happening. And I think that is just so encouraging to me that we have young people coming on that will be aware, and they will be aware of the truth and know about the men and be able to really talk about the humanity of the study and how you treat each other with dignity and respect.
Thank you so much for that. I believe we're at time. We still have a number of questions that are coming in, but I am confident in saying this is not the first time this partnership will be front and center. I think this is the beginning of a longstanding relationship with Voices and Patient Advocate Foundation. And, I hope to continue this conversation and the work that you're doing and help elevate the work that you're doing in your communities with the descendants. And thank you so much. I hope that you feel better. And thank you for taking so much time to participate in this conversation with me. It's much needed, especially at a time like this. And so I appreciate you so much.
Well, thank you. Thank you again, Jamie. And if you would send me those questions,
For
I
sure.
would be more than happy to respond, not today, but before the week is out.
I will. Thank you. Feel better. Go rest your voice.
Okay. Thank you so much and good luck with the rest of the program.
Awesome. Thank you.
Okay.
I now get to pass it over to Olga Lucia Torres, who is going to guide us through an interactive session on listening as a tool to achieving health equity.